Morning, everyone. Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant. First off, hopefully everyone had a good 4th of July. We had some nice weather, so it was real nice. We had a good weekend, but we're back to the grind. We're doing our videos again. This week we're going to talk about the shoulder joint. So before I talk about the shoulder joints and different conditions, what we treat, I'm just going to go real briefly what the shoulder is, show kind of what the functions are and everything. So I'm going to have my camera lady here kind of focus just a little bit in this area right here. The shoulder girdle is made up of 3 different sections. You have the scapula right here, you have the collarbone right here, it's kind of hard to see it, and then you have the head of the humerus right here, which goes right into that socket cavity there. Those 3 points right there make up the shoulder girdle. So the shoulder joint is considered a ball and socket joint. It's just like the hip. So it allows all ranges of motion, up, down, left, right, and what we call them abduction, adduction. But they also have something called circumduction, which allows us to move all around. So the difference between the shoulder joint and the hip joint is the shoulder joint ligaments aren't nearly as strong as the hip joint. The hip joint is the strongest joint in the body. If you've ever dislocated your shoulder, that's because the ligaments aren't quite as strong. Shoulder dislocations are very, very common. It's not something that a chiropractor can treat in the state of Pennsylvania. However, some chiropractors are specialized to repair a dislocated shoulder in a different state. And just in Pennsylvania, we're not allowed to treat a dislocated shoulder. So the shoulder has 4 very, very strong muscles. There's multiple muscles that are involved in the shoulder. And you can't really see them here, but they're located right in this area right here. They're the rotator cuff muscles. So the rotator cuff muscles are the infraspinatus, supraspinatus, subscapularis, and the teres minor. These muscles come together to hold the shoulder up and allow up and downward motions. Now, a lot of people may have had a rotator cuff injury. They are very, very common. Can chiropractors treat rotator cuff injuries? It just depends what type. There's 3 different types of rotator cuff injuries. You have a grade 1, which is just a real partial tear. Grade 2, there's a lot more of a partial tear. It's almost more like the muscle is torn off completely, but it's not. And a grade 3 is when the muscle is completely torn off. Someone with a grade 1, yeah, we've treated patients with grade 1 tears before. It's not very difficult to manage. Just some therapeutic treatment, some spinal manipulation. It seems to work really well. Grade 2, can a chiropractor treat it? Yes, but it is a lot more difficult. A chiropractor that is more specialized in sports injuries, that might be your chiropractor to go to. But a lot of people with grade 2 will start to go to the physical therapy route. Grade 3, that's one that the chiropractors cannot treat. That's something that definitely needs a surgical repair. So that's the more common injuries that we see in the shoulder. The other 2 common ones, degenerative joint disease, osteoarthritis, those are things I've talked about several times in the past blogs that we've had. The hip, we had a specific section on that. Bursitis is another one. Remember, with bursitis, I've talked about it a lot. Biggest thing with bursitis, put heat on that shoulder. That's the one thing I will tell people to do is put heat on, not ice, because again, heat's going to help bring in more blood flow, which will help eliminate that bursitis. One last thing that I'm going to talk about, and I'm going to talk about this, I've talked about it in the past, and I'm going to talk about it in the next several blogs that we have, is nerve interference. So I'm going to have the camera lady kind of focus over here again real quick. Nerve interference is what chiropractors treat. 85 to 90% of shoulder problems come from here, right in the neck. Notice that all these nerves in the neck run down the shoulder, run down into the arm, into the elbow, into the forearm, all the way down the wrist, hands, and fingers. That's what chiropractors treat. We're treating nerve interference. Whenever there's a blockage due to a bone rotation or a muscle tightness, that nerve is being affected, which causes pain, numbness, tingling. Will we focus on the shoulder? Yes, but in most cases we're going to treat the neck. If I'm not seeing much of a difference within a couple of visits, I'm really going to focus on that shoulder at that point. And that's something that I focus on a lot. So that's the biggest thing that I have for you guys this week. One thing I want you to realize is nerve interference. You're going to hear that a lot. So just keep that in mind. If you have questions, please reach out to me. Give me a call. I'll be happy to answer questions. Otherwise, that's all I have for you guys today. I hope you have a great week, and I hope you guys have a great weekend. It's supposed to be nice. So be safe out there. Have a good day.